Before we get to neuropathic pain, there was two other topics that I want to talk about briefly. One of them is neurotransmitters in nature, and so just take a look at this. This you probably haven't had this in optometry yet. Obesity is linked to lower gray matter brain volume. So if you look at that, your first impression is that lower gray matter, people that are large must not have as much processing power, and maybe that's why they make this bad choice of eating so much food now that we're all stuffed with pizza. And that would be kind of a gut reaction to an article that looks like that. So this came during lunch. I watched TED Talks, and this guy is talking about this wasp and this cockroach that live on the floor of the Amazon River, and they have been at war with each other for 1 bajillion years. And they have evolved through this point where if the wasp is able to get behind the cockroach in exactly the right spot, he can push his proboscis into the nerve system. The cockroach freezes. The wasp can walk in front of the cockroach, and the cockroach will follow the wasp into the nest where it is consumed by the baby wasps. Everybody knows that flamingos are pink. And flamingos are pink because they eat pink shrimp. But healthy shrimp aren't pink. There is a tapeworm that lives in flamingos, and it is pooed out over the brine flats way up there. Its life cycle is it regenerates itself through asexual replication, and then it needs to get back into the flamingo. And the way it does that is it infects the brine shrimp. It turns them pink. It changes their behavior so that rather than hiding on the bottom and being white and unable to be seen, they come to the top of the water where they're easily consumed by the flamingos. So that's an example of a tapeworm changing the behavior of a crustacean, the brine shrimp. In rabies, it's a virus that infects mammals, and it reproduces in salivary glands. It moves from one mammal to the next by causing that mammal's behavior to change in a fashion where it bites things, it makes it aggressive, it salivates. They have hydrophobia because they want to foam at the mouth and create the transmission, and it's going to use you to promote its existence. Toxoplasmosis is a protozoa that reproduces in cats, and it's pooed out of the cats, and it winds up using the other part of its life cycle outside of the cats. It needs to get back in the cat. It winds up in rats, and it changes the behavior of the rats to the point where they become fearless and way more aggressive, which makes them way easier to catch from the cats. Is there any evidence that same kind of thing can occur in humans? Common parasite linked to personality changes, and it's toxoplasmosis. So the schizophrenia bulletin. When infected human adults were compared with unaffected adults on personality questionnaires or on a panel of behavioral tests, several differences were found. So it makes people more social, it makes people more aggressive, their personality is way more outgoing, so it kind of does the same thing in humans as it does in rats. Now everybody knows about Clostridium difficile. Clostridium difficile is a bacteria that nobody ever heard about until about 15 years ago. And the reason we heard about it is because it can't be beat up by our current antibiotics. So what happens is you wind up with a surgery and they pre-treat you with antibiotics. It kills all of your normal biome. C. diff can't be killed by these bacteria, so you wind up with a bacteria that creates irritation in the stomach, and it makes irritable bowel, it makes people kind of sick. And the way to fix it then is something called fecal transplant. So you take the poo from one person, you put it in another person, and you can recreate the biome and make the person healthy again. So there's this gal in England who gets C. diff, and she doesn't want anybody's poo. She chooses her daughter's poo. Her daughter's obese. This woman had never been obese. Within a year, she is obese. She cannot stop eating. She is consuming everything she can in sight. Did the bacteria that her daughter have in her could possibly influence her behavior? So they have these mice, And these mice are born germ-free. And if you're born germ-free, the scientists can take whatever biome they want, put it in the mouse, and see how it behaves. Adaptive transfer of behavioral phenotype via the intestinal microbiota. Here we review evidence of microbiome-brain interactions in mice and focus on the ability to transfer behavioral traits between mouse strains using fecal microbiota transplantation. That's transputation. Transputation alters brain chemistry and behavior in recipient ex-germ-free mice, so they were germ-free to begin with, raising the possibility that fecal transplants for disorders of the central nervous system and prompting caution in the selection of fecal transplants donors for conditions that may include C. diff infection, diabetes, inflammatory bowel disease in humans. Transplantation of fecal microbiota from patients with irritable bowel syndromes alters the gut function and behavior in recipient mice. And here's an article that kind of describes how that exists. Is eating behavior manipulated by the gastrointestinal microbiota? And then when we go back to this one, the question is, do the people wind up obese because they have a biome that uses your body to promote themselves? The same as rabies and toxoplasmosis and all the other stuff. And we have yet to figure that out. So the real question is, do we have real free will, or did my bacteria just tell you to tell you all of that? So was I being manipulated? So we're going to switch to another topic. This is my topic this year. And it has to do with retina brain, and you might have been reading some of it. And I haven't studied this enough to really go into any detail, but there's a bunch of dementias, and where the dementia exists creates behavioral traits, and that's how they'll decide which dementia you have. So a person with Parkinson's has a dementia that is primarily in the brainstem, and they wind up with a shaky. ALS is the brainstem and spinal cord where they lose control of their bodies. Frontal lobe dementia obviously is frontal lobe. Alzheimer's is all over, and Lewy body dementias are, the two Lewy body dementias are Alzheimer's and Parkinson's, and they change your personality based on what portion of the brain winds up getting damaged. Evidence amounts that an eye scan may detect early Alzheimer's disease. Retinal thinning in correlation with functional disability in patients with Parkinson's disease. Abnormal retinal thickness in patients with mild cognitive impairment and Alzheimer's disease. Retinal examination by OCT and fundus autofluorescence reveals aggregations exactly similar to histopathological images of the alpha-synuclein is right before Lewy bodies, and Lewy bodies in live patients with Lewy body dementia. So there is now a substance that you can take called curcumin, and it's from turmeric, and it goes in your brain, and it causes Lewy body, it attaches itself to Lewy bodies, and they fluoresce at a certain wavelength. So my bet is the next OCT you're going to have is going to have that wavelength available, and so this is where my wild prediction comes in. Here's some more science showing the glowing Lewy bodies, retinal nerve fiber thinning in dementia associated with Parkinson's, dementia with Lewy bodies, and Alzheimer's disease. And cognitive decline can begin as early as 45 years old, warn experts. So this is what I think is going to happen. I think that optometrists are going to scan everybody in their 20s, everybody in their 30s, everybody in their 40s, and if we see an abnormal number of Lewy bodies begin to appear, we're going to send those patients to the neurologists who will treat their Lewy body dementia before they actually have any symptoms. So why did I bring up the stomach brain thing earlier? And it's because there's a ton of evidence that shows that that Parkinson's develops from the gut to the brain following the vagus nerves. and they can show it in rats move up into the brain following the vagus nerve up. So my bet is we're going to have to know about dementias, we're going to have to know about Alzheimer's and ALS and all that kind of, it's going to be part of our education down the road, and hopefully it'll be taught by someone who knows a whole heck of a lot more about this than I do. Bob Prouty's a good friend of mine, and we went to school together at Pacific, and Bob's kind of semi-famous. He teaches glaucoma courses nationally, internationally. So I ran into Colorado about a month ago, and he was describing these patients that they can't get their pressures low enough. They get it at 6 and 7 and as low as they possibly can, and the patients still progress. And I'm wondering if the glaucoma isn't from the eye back. I'm wondering if it's a dementia of the optic pathway. So instead of having Parkinson's where they shake, their dementia is occurring in the optic pathway, and we think it's glaucoma from the eye, but it's dementia from the brain. So something to consider. Does Parkinson's begin in the gut? That was that other thing. You know, how many times do people say, I got this gut feeling? Where does that come from? You know, just follow your gut. Maybe there's more to this gut-brain thing than we think. Vagus nerve is a modulator in gut-brain axis in psychiatric and inflammatory disorders. Gut dysbiosis and altered brain function. And that's all I want to say about that. But I thought those are some interesting topics, and that's what I've been studying this year.